September is the month of blood cancer awareness, and so a good opportunity to acquaint ourselves with the blood cancers. Blood cancer is an umbrella term covering a wide variety of cancers of the blood cells, and it is impossible in a few minutes to discuss the topic of blood cancers. And so I'm going to highlight some important concepts regarding blood cancers. Hi, I'm Dr. Francisca Osage, and thank you for joining me on Francisca on Health Matters. First of all, let's look at the composition of blood. Blood is made up of blood cells in a fluid called plasma, which comprises mostly water, actually about 90% water, and other substances such as proteins, glucose, minerals, hormones, carbon dioxide. However, for the purpose of this discussion, we're going to focus more on the blood cells. Now, there are three main blood cells. You have the red blood cells, the white blood cells, and the platelets. The red blood cells function mostly in the transport of oxygen to the various cells of the body. The white blood cells function in the defense of the body against disease processes, and the platelets function in the prevention and stopping of bleeding. Now, any abnormality of these cells will ultimately affect their function. Ideally, these cells are formed and developed within the bone marrow from stem cells. Now, these stem cells are likened to blank cells capable of giving rise to any cell. Within the bone marrow, the stem cells go through transformations, yielding a series of immature cells, which ultimately will form two main cell lineages. There's the lineage of the myeloid variety, and there's the lineage of the lymphoid variety. The cells from the myeloid variety will yield mature cells such as erythrocytes, neutrophils, and platelets. The cells of the lymphoid variety will yield cells such as T cells, B cells, natural killer cells. And these are the cells that will eventually go into circulation. And they have their distinct functions and roles. Now, when it comes to the naming of the cancers, this is based on a classification process. There's a classification based on the degree of progression of the cancerous process. There's a classification based on the cell lineage from which the primary cancer cell has emerged. And so, when talking about the degree of progression, you have acute cases or acute cancers or chronic cancers. For acute, this depicts a cancer that is fast, very aggressive, usually occurring within or emerging within days to weeks. Chronic, on the other hand, is an indolent process, slowly progressing, at times occurring within months to years, and is not as aggressive or debilitating as acute cancers. Of course, for the lineage, we talked about the myeloid or the lymphoid lineage. Therefore, an acute myeloid cancer is a cancer that is acute in nature, of which cells have emerged from the myeloid lineage of cells. A chronic lymphoid cancer is a cancer involving cells from the lymphoid lineage, the progression of which is slowly occurring. Now, common cancers will include the leukemias, the lymphomas, and myelomas. Hence, a chronic myeloid leukemia will involve cells from the myeloid lineage of cells and is usually slow in its course of progression. For the lymphomas, these are cancers involving cells which were originally of the lymphoid lineage that are now present in the lymphatic tissues, such as the lymph nodes. Myelomas involved cancer cells that originally from the lymphoid series as well, but have now specialized into producing antibodies. Now, when it comes to symptoms, there are a vast range of symptoms depending on the stage of the cancer and the kind of cancer. However, in general, you have the feeling of fatigue, there's weight loss. Specifically, in cases of lymphomas, you have swellings around lymph nodes, such as as found in the neck or in the armpits, in the abdominal region, depending on the kind of lymphoma. There's also fever that is not attributable to any known infection. Now, certain risk factors have been affiliated with the formation of certain blood cancers, such as chronic exposure to radiation, chronic exposure to certain products of petroleum, such as benzene, exposure to pesticides, exposure to certain infections caused by viruses, such as the Epstein-Barr viruses. Now, for the diagnosing of blood cancers, there are various investigations that are going to be carried out depending on the kind of blood cancer. Most times we start with the blood samples. Now, through the blood samples, we're able to establish an abnormal amount of blood cells present in circulation, as well as abnormal kinds of blood cells in the circulation. For leukemias, we go on to do the bone marrow biopsy. The aspirates of these can be analyzed through further studies such as flow cytometry and cytogenetics, which help to establish the presence of certain markers that are specific to certain cells. And these help in the prognosing of the cancer involved, as well as for the therapy. There are certain targeted therapy that are aimed at certain cells that are identified through these cell markers. For lymphomas, we have CT scans and PET scans, and these are necessary for the staging of the lymphomas. Now, the staging is used to determine the spread of the cancer, and this will determine the management of the lymphomas. In general, there's going to be the involvement of a multi-team in the medical field, ranging from the surgeon to the pathologist, the hematologist or oncologist, the radiologist. And depending on the complications that have accompanied these cancers, there could be the involvement of other specialists in the field of medicine. Now, following the treatment of cancers, there could be remission in which there is minimal or no observable symptoms present in a cancer patient, and also there is no detectable cancer cells. Or there could be relapse in which there is a reemergence of symptoms and detection of cancer cells present in the patient. Now, there's also what we call a 5-year survival rate, which indicates the prognosis of the cancers. And over time, this has improved following the advancement in the treatment of various blood cancers. And with that said, there is hope that in the future there's more advances in the management of cancers. And hopefully, we can start by creating awareness of blood cancers. Again, I hope you found this informative and educative. And if you have, please subscribe, and I'll see you in the next one.